Hello and welcome to MLab 1101, Introduction to Clinical Laboratory Science. My name is Dustin Scott Brewster, and this is going to be the first of a three-part presentation for the first unit of this course. Now, before we get into the actual material, I want to first discuss and highlight the importance of the objectives. Now, for each unit, we are going to cover unit objectives. Now, if you want to do well on your exams, my advice is the first step before you dive into the unit content. I want you to review what is expected for the students to know. These are called the objectives. These are the expectations we have that you will understand by the end of that unit. So first look and familiarize yourself with the objectives. I would then review the content, and then I would go back and I would answer each one of these objectives. Now, if you can answer all of these objectives for each unit, chances are you're going to do quite well in that course. So for this unit, I want students to list the key moments in the history of laboratory medicine, define terms associated with laboratory regulation, certification, and accreditation, describe professionalism, list the common types of healthcare facilities that house clinical laboratories, describe the departments of a clinical laboratory, identify the specific healthcare roles authorized to order laboratory tests for clinical testing, identify laboratory testing order priority based on urgency, whether it's a routine, ASAP, or stat test. I want you to be able to describe the roles and responsibilities of laboratory personnel. I want you to define the levels and roles of regulatory agencies for the clinical laboratory. Describe the professional organizations for laboratories and personnel. Define the three levels of complexity for testing in the clinical laboratory. And I want, probably most importantly, students to define HIPAA. What does HIPAA stand for? And what includes or constitutes protected health information, or PHI. One of the first things I'd like to discuss in this unit is the history of clinical laboratory science and some of the milestones and achievements that allowed us to practice clinical medicine today. So beginning at around 2500 BCE, we have some of the earliest evidence of laboratory testing where Egyptian physicians would pour urine on the ground and then observe to see how attracted ants were to that urine. Now, they didn't know this or why they were attracted at the time, but it's likely due to the presence of glucose. Around 400 BCE to 16 to 1800, we weren't quite sure what was the cause of human disease, but it was believed that it was from an imbalance in one of the body's four humors, blood, phlegm, yellow, and black bile. And when we had too much or too little of one of these humors, that was the cause of human disease, which of course we know that is not true. Then, kind of overlapping around the same time, from roughly the Middle Ages to the 1800s, we began to think that it must be bad odors or bad smells or miasma, or as what they're called. They must be the cause of human disease. And of course, in areas where we had more of these bad odors, we were more likely to run across human disease. But that wasn't the cause. In fact, it was most likely from large amounts of people living in urban environments with poor sanitation, poor infrastructure. That was likely to be the cause of the spread of disease in those regions, not actually the odor. So before we could identify what really is the cause of the spread of disease, we need to observe things on a more microscopic scale. So in 1660, there was a Dutch lens maker by the name of Anton van Leeuwenhoek, who is credited as one of the first developers of a compound microscope. And what he would do is he would take samples from his cheek or off his teeth, and he would observe the presence of little organisms that he wasn't quite sure what they were called, but he called them animalcules. And then in 1665, another scientist by the name of Robert Hooke was taking bark from cork trees and observing those under his microscope, and he noticed that they had little prisms that he called cells. And fast forward to 1839, where we had two scientists working together, Schwann and Schleiden, that were looking at these cells, and they were looking at animals and they were looking at plants, and they noticed that they all had these cells, and they theorized that all living organisms must be composed of cells, and that must be the basic unit of all organisms on Earth, and that all cells must come from other cells. And these principles are known today as cell theory and the foundation of modern cell biology. Now, in 1854, it's still largely believed that miasma is the cause of disease, but there's a scientist or physician in Soho, London, when there's an outbreak going on, and he noticed that all of the people that are coming down with this sickness are all getting their water from the same source. And this physician by the name of John Snow theorized that not miasma, but some other source must be causing the spread of this infection. And of course, he got permission to remove the pump from the well where all these sick people were getting their water. And as he theorized, everybody started getting better because he removed the source of that disease. And fast forward a little bit to 1884, there's another scientist by the name of Robert Koch who actually isolated Vibrio cholera and other organisms to help confirm what John Snow had believed. And these scientists together created what we now practice as germ theory as the cause of disease. Now, because germ theory was starting to take off as the cause of disease, and that was beginning to spread, I didn't include this on here, but there was a famous surgeon by the name of Joseph Lister who saw that there was an increased incidence of post-operative infection. And as germ theory was starting to catch on, he wanted to practice germ theory, and so he decided to sterilize his surgical equipment with carbolic acid. And sure enough, the mortality rate or the infection rate of post-operative surgeries drastically reduced once he started cleaning his instruments. Now, we know that at this point, germ theory is the leading cause of infection, and getting people together in tight spaces is going to increase the incidence of infection. So in the 1890s, as large groups of people were coming over on boats and poorly sanitized vessels, they had a need to take a systematic approach to do wellness screens. And this is kind of the birth of modern laboratory medicine as we know it, to have a systematic approach of screening all of these people. And in that period, that was kind of the cause and the need to do that. And then in around 1896, we had the first clinical lab open at Johns Hopkins University in Baltimore. So moving forward into the 20th century, in 1922, we had the formation of the American Society for Clinical Pathology, which is going to help pave the way for a more systematic approach for performing routine laboratory testing. Then in 1928, we identified the need for not only a systematic approach for laboratory testing, but we needed to have some type of competency for trained laboratory professionals. So the ASCP Board of Registry formed a certification exam for laboratory professionals. Then in 1933, the American Society for Clinical Laboratory Scientists was formed. Then in 1957, and this is after World War II, we had the introduction of the first analyzer in the clinical laboratory. Now, this is a really big deal because up until then, we would have one laboratory professional performing one test on one patient, and it's very inefficient and, as you would imagine, not very reproducible. So, with instrumentation, that allowed for the reproduction and efficiency of a lot of testing. So I could do the same test over and over and over again on a large scale. So it decreased turnaround time, increased efficiency, and helped drive the way for how we run clinical laboratories today. Then in 1960, we had the development of CMS, the Department of, or the Center for Medicaid and Medicare Services. In 1976, we had the National Credentialing Agency for Clinical Laboratory Personnel, or NCA, which was formed by the ASCLS. Then in 1988, Congress passed the Clinical Laboratory Improvement Act. Now, I'm going to talk about this in much more detail, but the CLIA Act, or CLIA 88 as it's commonly referred to, this is where Congress got together and they decided that we needed to have regulatory requirements for all clinical laboratories. So if you're going to do testing on a patient for the purpose of diagnosing, treating, or monitoring the health of that patient, it needs to be regulated by these regulatory agencies, which I'll get to in more detail. But this is where it all really began, how we practice laboratory testing in the modern lab today. And lastly, in 2009, the National Credentialing Agency was assumed by the ASCP, and the ASCP is probably the most common non-government agency that is for credentialing laboratory professionals. So now that we've established the timeline for where we are now with clinical laboratory science in modern medicine, I want to talk about what specifically is clinical laboratory science. Clinical laboratory science, or CLS, is a profession concerned with the performance of analytical tests on samples taken from the human body. That could be blood, urine, feces, anything that comes out of the human body, in order to identify the presence of disease, to treat disease, and to monitor a patient's health. So anything that a doctor can use to make a medical decision, those are the things that are performed by clinical laboratory scientists. So what is the scope of practice for clinical laboratory science? So as defined by ASCLS that we mentioned in the previous slide, they are going to be responsible for assuring accurate, reliable, reproducible tests for patients. So monitoring disease, diagnosing disease, treating disease, and monitoring patients' health. Now, in order to stay caught up with current trends, it is important for a laboratory professional to do continuing education. Now, you probably noticed in the previous two slides, and of course that wasn't an exhaustive list of the timeline of clinical laboratory science, but you could see things were very spaced out at the beginning, and then toward the end, we started having a lot of milestones more and more frequent. Now, that's just the nature of the progression of science and technology, and as things get more advanced, new techniques are developed, and because of that, it's important that current operating clinical laboratory professionals stay caught up, and so they have to perform continuing education to stay caught up on their credentials once they pass their board of certification exam. So now let's talk about institutional credentialing. So a clinical laboratory scientist or a clinical laboratory professional, they are going to work in an accredited clinical laboratory. So I'll talk about clinical laboratories later, like a reference lab or a hospital lab, but the important thing is that that lab or institution has to be accredited itself. So how do we get accreditation for one of these institutions, whether it's a hospital, reference lab, doctor's lab, whatever? That means that they have to go through a voluntary process in which a non-government agency will come in and inspect and recognize that you meet or exceed the standards established by CLIA 88. So if you're in a larger hospital, more robust type laboratory, they probably want to go through an accreditation agency like the College of American Pathology. So that's going to be the most common in bigger hospitals, like a hospital again, or something like CPL, a big reference lab, or ARUP. They're going to use the College of American Pathology to accredit their laboratory. If it's a smaller laboratory, maybe they don't have as many tests or maybe not as complicated of tests like a hospital would, like maybe a doctor's office, they could probably get away with going through a agency like COLA, the Commission on Laboratory Accreditation, where they're doing far fewer tests and far less complicated. So those are two examples of accreditation agencies for clinical laboratories. Now, as I said in the last slide, not only the institution has to be accredited, but the operator or the laboratory professional also has to be from an accredited institution. So before you can get certified, it is important that you go through an accredited institution. So the college that you go to also has to be accredited. So for medical laboratory technology programs or medical laboratory science programs, those programs themselves get audited by an organization called NACLS, or the National Accrediting Agency for Clinical Laboratory Science, where they will go into that college or institution and make sure that they are meeting all of the minimum requirements that are necessary for an entry-level clinical laboratory operator. So now let's talk about professional credentialing. There are a lot of professions in healthcare that require some type of credentialing depending on the complexity of that profession. So first off, registration is when an individual has entered an official registry that shows that they have completed some type of established training requirement. So this could include a CNA, a pharmacy tech, or an EMT. Certification is going to be verification that an individual has completed an accredited and approved educational program and that they have passed a national certification exam. So I mentioned previously for organizational accreditation, we talked about academic institutions like MLS or MLT programs. They get accredited by NACLS, the National Accrediting Agency for Clinical Laboratory Science. That means that somebody that wants to be an MLT or an MLS, they need to go through an accredited program, pass that educational requirement, and then also pass their national certification exam. Licensure is the legal authorization granted by a state and is going to permit a limited scope of practice for that profession. So licensing shows that the individual has completed an accredited professional program and also taken and passed a national or state licensing exam. Individuals that need licensing include medical doctors or doctors of osteopathic medicine, registered nurses, pharmacists, or physical therapists. Now, it's important to note at this point that MLTs and MLSs do not actually need licensing, they need certification. So let's jump back into laboratory professionals and the general types of laboratory professionals that you may see in a clinical lab. First off, we have phlebotomists. Phlebotomists' main roles are collecting specimens, transporting specimens, usually receiving specimens in the lab, and then distributing those specimens to the appropriate department for testing. Medical laboratory technicians are going to perform those analytical tests, and medical laboratory scientists, or MLSs, sometimes referred to as CLSs or medical technologists, they're also going to do the analytical testing, possibly collect blood, transport, receive samples, everything that an MLT and a phlebotomist will do. They just tend to go into more details of the analytical scope of practice and testing that may be done in a clinical lab. So now I want to talk about professionalism. So what does it mean to be a professional, or what does it require to be a healthcare professional? Well, you have to be courteous. You have to be courteous both to your coworkers, to other healthcare staff, and above all, to the patients you're serving. You have to be conscientious of what it is that you're doing. Now, with working in healthcare and certainly in laboratory science, you have to appreciate the details in what you're doing. You can't make any mistakes when you're pipetting. You can't make any mistakes when you're mixing samples for reactions, biochemical reactions in micro or blood bank testing. It's very unforgiving work, so you have to be conscientious of what it is that you're doing. You have to have a business-like appearance and behavior. What does that mean? Well, you have to show up to work ready to go, looking professional, and having the right attitude. It's very important. It creates a cohesive environment with the laboratory staff and with the healthcare providers in the hospital. So that appearance and behavior is very important. So why? Well, of course, it's going to promote confidence. If I have a phlebotomist or healthcare provider that's providing services to me as a patient, I want that person to exercise that professionalism because that's going to instill more confidence in their ability to do their job. It's also going to encourage a positive, uplifting environment. Now, hospitals can be a very stressful environment, but if everybody comes to work with the right attitude, with the right behavior, and ready to go, being conscientious, being courteous, being professional, now it's going to create a more positive, uplifting environment. It's also going to create safety in amongst patients and coworkers. So I'm going to feel more comfortable and willing for healthcare providers to provide services to me if they practice that professionalism. So for all of those reasons, professionalism is of the utmost importance in the laboratory and in healthcare in general.